Hello, my name is Caitlin Lee, and I will be presenting misdiagnosis Black people of color face in dermatology, just like how this dermatologist is inspecting this woman's face. What's the difference between these two images? They look different, so they must be different, right? Wrong. These images are actually both showing eczema. The one on the left is on a Black person, and the one on the right is on a white person. To the untrained eye, one would not be able to tell that they're the same skin condition. A dermatologist who has not been trained to look for different characteristics that appear on a Black person of color or someone with darker skin tones will often misdiagnose the patient, while the white patient will have a higher percentage of proper diagnosis. The biggest cause of misdiagnosis in dermatology for Black patients is that many dermatologists aren't properly exposed to how a certain skin condition appears for different skin tones. This is from the lack of diverse images in medical textbooks and lack of skin color education in medical school. Because the medical students aren't being trained for a diversity of patients, it leads to the problem we're discussing in this presentation. Only 2% of teaching events at the American Academy of Dermatology focus on color of skin. As the United States is becoming more racially diverse faster than ever, this has to change now. So, what are we currently doing to lower misdiagnosis in Black patients? Along with adding information into textbooks and curriculum, further advancements in non-invasive technology to properly diagnose all patients have also been developing. While biopsies may be accurate, they often have a negative side effects such as infection and pain as you're cutting into the skin. Confocal laser microscopies allow the doctor to have a higher resolution of the skin condition of the dermis and epidermis. However, it cannot diagnose many skin conditions as it is developing, and technology is still limited. So what can we do for the future? The biggest thing that we can do is fixing the root of the problem. Properly training medical students to identify different traits to look out for in different skin tones. We need more research so that there can be a wider variation of images in textbooks. When preparing for this presentation, it was quite difficult to find pictures of different skin conditions in different skin tones. Training doctors of tomorrow to help detect and treat conditions will help prevent misdiagnosis and lower mortalities that Black people of color face with skin cancer. Training to detect a diversity of skin tones can help shift curative medicine to preventative health, which would also help these communities who have historically lower socioeconomic statuses who may not have access to healthcare. So my discussion question is, more diverse textbooks are teaching medical students specializing in dermatology in an attempt to decrease misdiagnosis. What can be done for current dermatologists who have not been exposed to the same amount of training after medical school? How can we retrain them without going back to medical school? And these are my references.